Alrighty. Hi, everyone. My name is Hannah Greco. I'm the Senior Admissions Operations Manager at Virginia Tech Carilion School of Medicine. But first, I usually have this up already pulled up, but if you don't mind scanning this code, this QR code, it will send you to this, basically a link for you to put in a little bit of information about yourself. It also includes a link to our digital brochure as well. It adds you to the mailing list, but we send out maybe 2 emails a year. It's really also just to kind of keep track of who attended these presentations, and just to kind of keep us organized in that way. I'll also post I can do that. I'll post the link itself in the chat. And give you guys a few minutes to scan. So I also posted that tiny URL link in the chat as well. So feel free to do it on your phone or on your computer. This link will also be at the end of the presentation. So if you don't want to do it now, that's totally fine. Again, I introduced myself. I've been at Virginia Tech Carilion for 3.5 years now. So I know my way around the school. If you have any questions in terms of student life, I can kind of give you an idea about that based on a lot of my conversation and interactions with our current students over the past 3.5 years. And also I'll have my email at the end of the presentation, and you're welcome to send me any questions via email as well. So for this presentation, what I'm going to do is kind of give you, it's broken up into 3 parts. I'll talk to you a little bit about the school itself, a little bit about Carilion Clinic, which is our large health system that is what the school is partnered with, and then a little bit about just applying to medical school in general. And at the end of each section, I'm happy to answer questions, or if you want to wait till the end, happy to answer them then as well. So I like to start off all my presentations giving our mission statement, just to kind of give you an idea of immediately what Virginia Tech is all about, and what we're looking for and what we're hoping to build when we are accepting students into our school. So our mission is to prepare physician thought leaders through innovations in medical education and cutting-edge discovery to improve the health of our communities and transform healthcare. So again, cutting edge discovery being the keyword there, very research based, and I'll get to that in a little bit, but this is kind of giving you an idea of we're all about the medical school typical curriculum, but we're also adding that factor of research in there as well. So how did Virginia Tech Carilion come to be? A lot of people call us just Virginia Tech's medical school, which is true, but this Carilion Clinic aspect is also a big part of our mission and how we came to be. So we were founded in 2010, so a relatively young medical school, and I'll get into that in a little bit. But Virginia Tech is a very popular local public land grant university, very research based, very much into the sciences. And then Carilion Clinic is our not-for-profit, very large healthcare system in the area. So they together decided to create a medical school where they're using that partnership with the public land grant university and the private healthcare system to provide a very unique medical school curriculum. So a few exciting features about our school is the small class size. If you're somebody who thrives in classes in which the professor knows your name, and you get to know all of your fellow students very well, then this is a very great school for you. And because of its size and the amount of students and in terms of faculty as well, we offer unparalleled mentorship throughout, and that's through various different types of mentorship. That could be obviously research mentorship, but we also are very concerned with the well-being of our students. So we have wellness mentors, financial mentors, academic mentors, and things like that. And that really does, you really get that sense of community through the mentorship from the very beginning of your time here. And then another aspect that I like to bring up is that you will, if accepted, get interacting with the patients starting the very second week. And that is, it technically is the first week, but that orientation week we do at the beginning. So we want to make you see the connection to the environment that you're going to be in immediately, because I think a lot of the times in medical school, at least in the first few years, you get very caught up in the academics of it all, studying, and you kind of lose focus on what you're actually doing and who you're trying to help. So we've tried to build the curriculum in a way that you're staying with those patients and seeing the impact that your future career will have from the very beginning of your schooling. So we have four main value domains, and basic science and clinical science you see in most medical schools, but research and our HSSIP, which is a fun acronym, and it used to be just interprofessionalism, but these two are more specific to our school, and I'll give you a breakdown of those value domains here in the next few slides. So basic science, we teach our basic science through problem-based learning. I'm not sure if everyone is familiar with that, but we start all of our students in the first and second years in small groups of about 7 to 8 students. And you are with that group of students your entire first block, and then it changes every block after that. But you as a group are kind of teaching each other the material through patient cases. And these are real patient cases of local people who have given us permission to use their test results, their doctor visit notes, things like that, to learn all of the basic sciences that you need to learn in medical school. Of course, it's not going to be just the students. We do want to make sure you're going to pass your exams and you're not veering off in the wrong direction. So there is always a faculty facilitator in the room with you who's going to make sure you're staying on track, hitting all of the objectives that you need to hit, and making sure that you're learning the things you need to pass the exams at the end of the block. So you will get a new patient case every week. And again, at the end of each block, which is about, depending on the year, the first year it's 8 weeks, you'll switch and you'll have a totally new group of students to work with and learn with. But by the end of your second year, you should have worked with everyone in your class at least once. So again, that small class size is very important, and making you feel kind of at home, knowing the familiar faces, and also finding people who have the same learning style as you, who you can work with and, you know, come up with study groups with and study for exams and things like that. And a few pictures here just to demonstrate. Our school has a bunch of PBL rooms that sole purpose is to do these patient cases every week. So these are a few pictures of that. There's a big table in the middle, and now each of these cubbies have a new computer. The cubbies are there for you to keep. I've seen a lot of snacks in there recently, so it's a great space though for this one block. You can keep your books and some of your personal things, snacks, and I see a lot of people in those rooms studying outside of PBL hours. So, and then down at the bottom, you'll see the man in the tie. That is the faculty facilitator. So again, you are going to be kind of staying on track and in the right direction, not just with your peers there. This is a classic schedule, a rough example of a schedule that you would be doing your first 2 years. So you might have a few lectures in the morning, and your PBL classes will always be Monday, Wednesday, Friday. And again, you'll learn about the patient case, you'll take home objectives, learn about them, then present your specific objective to the class on Wednesday. get a little bit more information about the patient with more lab results, more notes, family history of the patient, create more objectives with your group, go home, research that, present it finally at the last class period on Friday, and then you'll do the patient wrap up, which I'll show you a few pictures of in a minute. That's where you get to meet the actual patient that you were studying about the whole entire week. So that is a great way also that we try to keep you guys interested and involved when you can actually speak to the person, or in some cases family members, if the patient has passed away, and the diagnosing doctor as well. So I'll show you a few pictures of that in a moment, but I also wanted to make note of the lots of unscheduled time, the lunch breaks, things like that. So a very big component of the way we built the curriculum is the essence of time. And by time, I mean free time. So there's a lot going on your first few years at medical school, but that doesn't necessarily mean you need to be drowning in work. We try to keep in mind that there's a lot of life that you're doing, especially if you're probably moving to the area. So this unscheduled time could be time to go to the grocery store, go to the gym, catch up on a class that you might have missed the day before, things like that. So you'll see that as well in terms of the amount of time that we've provided for research related activities, and I'll show you that in a minute as well. So just to keep that in mind. And then this picture on the top right or top left here is a picture of the patient wrap up. Let's see. So we have the diagnosing doctor here and the patient, and it looks very much like a talk show host, kind of Oprah vibe, but all of the students will be in the audience and they can ask questions to the doctor and the patient about some of the stuff that you might not have thought about or might not have been as apparent in your basic science learning that week. So like, did your insurance cover your medical procedures? What stood out to you about your care that was given to you at the time? Did the doctors and nurses listen to you? So some of those real aspects that every patient has to deal with, but maybe you not necessarily always in your textbook. So that's just an idea and kind of gives you a picture of what those patient wrap-up cases look like. So that's how you learn basic science. Clinical science, you'll do that through standardized patients, which a lot of medical schools, I think, are utilizing now. You'll do standardized patients through all 4 years in our OSCE suites, which we have 10 OSCE suites in our medical school, and they're set up to look and mirror exactly like the clinical suites that you'll be in during your years 3 and 4 clinical rotations. So we want you to get comfortable with the environment that you're working in, and have a feel for all the instruments and resources that you would have in that space. Another way to do the clinical sciences, we do the longitudinal ambulatory care experience, which from now on I will be calling LACE because it's much easier. But that is when you're going to be with a doctor, a local doctor who will take you into the clinic. And this is also how you do your interactions with your patients in the first, second week of school there. You'll be in the clinic with a doctor, kind of shadowing in a way and learning from them in that aspect. The state-of-the-art SIM Center is also a way in which you'll be learning clinical sciences. And that is a SIM Center that was within walking distance from the school. And I'll show you a few pictures of that, I believe I have later on in the presentation. And then, of course, training at a level 1 trauma center, which is our flagship hospital. And you'll be doing that during your clinical rotations in years 3 and 4. All right. Again, I mentioned research being fairly important to our medical school. So our whole goal is to train physician scientists or scientist physicians. And ultimately, we hope that you'll be able to conduct original hypothesis-driven research, and ultimately having publishable quality research project by the end of your 4 years. The span of your project is going to last about 3.5 years, because that first half a year when you just start school, you'll be figuring out what type of project you want to do. You'll be speaking with your research mentor, who's going to kind of help you find the right researcher and PI that will take you under his or her wing and kind of help you with your project the next 3.5 years. But then from then on out, you'll have a lot of time to meet with them and plan your project throughout the next few years. You'll also be allotted $1,000 a year in years 2 and 3 for research supplies. And most of that money is to offset your presence in the research lab with the PI, but also it can be used for any unexpected or emergency fees as well. I mentioned time being a big thing. We try to dedicate about 1,200 hours of curriculum time specifically for research, because again, it's a very important aspect of the school, but it's also something we recognize needs to have its own set schedule and time away from your studies as well. So again, we're trying to make sure that you're not drowning in schoolwork, but then also trying to fumble around and get a research project together. So I'll show you how that kind of works in terms of and how the breakdown of that works in years 1 through 4. But first, I'm going to speak a little bit about our final domain, which is health system science and interprofessional practice. It's made up of 2 things: health system science, which is referring to how healthcare delivery systems provide high value care to patients, but also how you work in teams, which is the interprofessional practice as well. Because you're not going to be solely a doctor, and you make up the entire team. You're going to be working with nurses, PAs, lab techs, things like that. So we're going to kind of get you familiar with that teamwork, team building, conflict resolution right from the beginning. You'll be working with some of the students, the nursing students and PA students from Radford University Carilion. So that's the local nursing PA school. And you'll be doing a lot of interacting with them at that SIM center that I mentioned. Again, all of this is to kind of help you realize and reflect on how you're communicating and what goes into patient care as a team from start to finish. So I mentioned going through some of what the years will look like. So years 1 and 2, this is an overview of year 1. Year 2 looks very similar, just with shorter blocks. Again, there is talk about some of this changing, so I'll just kind of go over this briefly because there might be some changes in the next few years in regard to how this is set up. But ideally, what we'll be doing is you'll be hitting all 4 value domains in each block. So you'll see the different colors here represent the 4 value domains that I just mentioned. So the functional biology of cells and tissues, that would be your basic sciences. Your orange here, interviewing and physical exam, that's going to be your clinical sciences, fundamentals and foundations of research, your research domain, and then of course the health system science and interprofessional practice there in purple. But again, each of those 4 value domains are going to be in each block throughout your first and second year. So year 1, the blocks are broken down into 8 weeks. And after every block, you have an exam week and then a week of special studies. Special studies is a fun word for either remediation, in which you might have not done so great on the exams the week before, might need to refocus, talk to one of our faculty and kind of get a game plan on how to retake that exam. Or if you pass all your exams the week before, it could be a great vacation week, or a week home to visit family, or a week to kind of catch up on some shadowing, local shadowing, things like that. That's basically, if you use it right and study hard, it's a week off after every break, after every block. And then after block 4 of year 1, you'll have several weeks allotted for research, and then a longer, kind of more proper break. It's not a full 3-month summer break, but it is time for you to do bigger trips or do longer visits home, that type of thing. Year 2 looks very similar. It's just 6 weeks instead of 8. Again, you'll still see the 4 value domains there. Again, you'll have a week of exams and a week of special studies, but because the blocks are shorter, the last block ends in February, and then the rest of the time is really there for research and step 1 prep and testing. So again, time allotted for research, but time to study and make sure that you're prepared for your step 1 exam. Years 3 and 4 are your clinical rotation years. As with all AAMC schools, your required clerkships of 6-week rotations will be in the core clinical disciplines of internal medicine, surgery, family medicine, pediatric psychiatry, and OBGYN. And then depending school to school, there might be an additional 2-week rotation. For us, we like to see you guys do a little bit of time in radiology, a little bit of time in neurology, a little bit of time in geriatrics. So you see that they're kind of broken down. And then again, research will continue to be integrated. Time will still be allotted for your project as that's growing in development and probably gaining a lot of steam by year 3. Year 4, very similar. You will be completing a 4-week clinical experience in emergency medicine, as well as electives, including 1 medical subspecialty, 1 surgical, and 1 ICU. But those can be tailored to your interests. So if, for example, you're interested in cardiology, you can do your ICU rotation in the cardiac ICU. If you're interested in neurology, the neurological ICU, things like that. So again, year 4 is a little bit more flexible in terms of how and where you spend your time. Lastly, there will be time for research and of course match. So making sure you have a lot of time for interviewing those programs. I know because there's a lot of traveling involved, at least before the pandemic, but a lot of time prepping for those residency interviews. Also some time for much needed vacation as you're rounding out your 4th year. So that kind of wraps up the about Virginia Tech Carilion. Any questions about the school itself? If you can't think of any now, that's fine. We can, there'll be plenty of time at the end of the presentation as well, but thought I might open up the floor. You can use your raise your hand feature, that might help. All right, if not, we will go ahead and talk about Carilion. So again, Carilion Clinic is our healthcare system that we're partnered with. It's also, this is our flagship hospital. This is within walking distance. You can actually visually see it from the medical school. This is where you'll do a lot of your clinical rotations in your 3rd and 4th years. So just a little bit of background on Carilion Clinic. We have almost 750 physicians. I think this number is a little old. Over 75 specialties, over 225 practice sites. We bring in we have a lot of admissions. There's over 1,000 beds in the hospital, not including the NICU beds. And then we have about 175,000 emergency department visits over the year, but that's including our multiple sites, our multiple emergency departments throughout the region. But about 90 to 100,000 of those are through our main emergency department in our flagship hospital here. We are the only level 1 trauma center in the region, and we are also the only level 1 pediatric trauma center in the region. So that means there's a lot of people being flown in or people traveling to receive emergency care here in our hospital. And that means also a really great patient population to learn from as medical students. And speaking of patient population, this map is a kind of visual representation of how far our reach goes. We have people coming in from over the mountains from West Virginia into Kentucky, even down into North Carolina as well, because again, we are that only level 1 trauma center in the region. So we have about 1.7 million patients in our population, which means there's a lot of medical diversity. We see a lot of urban medical issues coming in through the emergency department, but we also have a lot of tractor accidents that have happened from a farmer, a couple hours away, that are being flown in. And so that again provides a lot of different types of patients who are there to receive care, but also a lot of patients to learn from and get familiar with. I spoke of, and I think on the other slide, there was about, let me see here, total revenue of 1.7 million, 7 billion in revenue, but a lot of that, and this is what I have on this slide, we do a lot of outreach and charity. So a ton of money that we get every year also goes back into the community through the free clinics in the area, through programs, healthcare programs throughout the region, and back into our medical school as well. So while we do make a lot of money in our Carilion Clinic health system, a ton of that goes back to the community as well. I won't read through all of the residencies and fellowship programs that Carilion Clinic offers, but I put this slide in here for 2 reasons. And that is because, number one, if you do like the area, this shows you that there is a lot of opportunity to stay in the area. You can apply for all of these different residencies and fellowship programs, but also, even though Virginia Tech Carilion is a relatively young relatively young medical school, this hospital system has been a teaching hospital for a lot longer than that. So all of the doctors and all of the medical staff in Carilion Clinic are used to students and used to people asking questions and shadowing them. So that's not something that you have to fight through the awkwardness of, as you might typically have to with a new medical school. So any questions about Carilion Clinic? And I see, let's see, Ms. Campbell put a question in. What type of experiences would be required for an ideal applicant? So we love to see, and you guys might have heard this a lot, and I will probably touch on this in a little bit in the next few slides. We're looking for a very well-rounded application from all of our applicants. There's no ideal applicant necessarily, but we're looking for someone who has kind of dipped their foot in a lot of different pools, who has shown leadership in a lot of different areas or team building. So in terms of medical experience, it might be, you might have done some shadowing, you might have done volunteering. We see a lot of people who've done scribing. And I always mention that if you can get medical experience that also pays you in the meantime, that's great. So that just benefits you as well as gets quality experience on your resume. And then research, again, is a big deal. We want somebody who's interested in research, just because if it takes up almost 4 years, you're doing that basically since the first day that you get there, or at least thinking about the project that you're going to be doing. So it's something that if research isn't interested in, we don't want you to have to kind of put yourself through that, or kind of just check the boxes to get through it. It's just something that you are interested in, or a path that you want to follow. So any experiences there, we've seen research assistants, lab techs, things like that, where you're getting in there. And again, it's quality over quantity. So it's not necessarily somebody that has 3,000 hours is going to beat out somebody who has 500 hours. especially if that person with 500 hours has a lot of experience, hands-on, has really invested in themselves in the lab, worked with a lot of the other lab members, and is really helping propel that research forward. Again, we're looking on that more favorably than, say, somebody that has just a ton of hours doing, again, very minimal things in the lab. And again, we also know that you guys aren't just sitting there doing research and medical experiences. We'd love to hear about anything that has to do with like your time at college, your clubs, your sororities, fraternities, your sports, theater, anything that kind of shows us who you are as a person and how you relate to others. Because again, we're such a small knit community at the school that it's we want to make sure that you fit in as much as and it's not an awkward fit either way. So I think, do we have any other questions beyond that? And then again, I'm going to touch on a little bit about what we're looking for and how to apply in the next section. Okay, let's see. I have another one. What type of scholarships are available for applicants? Are they merit-based or various types of scholarships available? So we have several types of scholarships available. One of our big one is we have a few merit-based and a lot of need-based. We have several need-based. One of our big ones is the Impact Scholarship, which awards $25,000 there's 4 students picked every year, but then you get $25,000 for each year of medical school. So that one's need-based and diversity driven, not necessarily specific people, but the fact that you're interested in bringing diversity or promoting diversity in the school. So that's our big one. And then there's lots of smaller ones as well that you would apply for after you have been accepted. Any other questions? Okay, so I'll just touch on now about applying. So this is just an overview of what the application process looks like. So hopefully within your junior year or even maybe before, you'll have started preparing and taking your MCATs. If you haven't and you're a junior or a senior and you haven't done that yet, that's fine. But it's just something because the MCATs require a lot of study time, that's when we usually suggest learning and kind of preparing for the exam. Then the AMCAS application, that's going to be your bulk of your application to medical school, including your transcripts. You'll be able to list all of your experiences. Up until then, you'll be writing your personal statement about why you want to be a doctor, what led you to medicine, and then just a few other things, just demographic things as well. So some of your personal information there. So all of that goes into your primary application. You'll include letters of support. And a few things there is that we require that one letter of recommendation come from a science or math faculty member. But they should also maybe be coming from somebody in the medical field that you've worked with or shadowed for or scribed for. And then also somebody in the research field as well. We require at least 3 letters of recommendation, but we also accept committee letters as well in place of those 3 letters of support. And then our secondary application. So once you submit all of that and receive your letters of recommendation, we'll do a preliminary review of your application and then determine whether or not you would meet the criteria to be invited to complete a secondary application. Those secondary applications are specific to each school. So ours includes about 4 essay questions and a few other demographic questions as well. And those are designed to kind of give you an opportunity to speak more about your experiences and your point of view, but it's not necessarily something in which you need to reiterate a lot of what you've already put into your application. This is a time to kind of bring us new information, provide a different perspective that you might have already put that you might not have already put into your primary application. And then if that looks good and we review that completely, we will invite you to interview. We have in the past few years been doing a mix of, this past year we did a mix of virtual and in person. And I think that's what we'll be doing next year. We haven't set a firm plan on that yet, but that's in the works. Just a couple things though to remember. This whole process is very expensive, so there are a few things that you can do if you think you might need fee assistance. So there's the fee assistance program through the AAMC that will drop the cost of your primary application and your secondary application significantly. So if that's something that you think that might work for you, I encourage you to apply for it. It drops our secondary application fee from $70 to $15. And so again, that's something, but to be aware of the application process to medical school in terms of also going and interviewing, that can be expensive. So just take that in consideration when you are applying. This is the admissions timeline relative to our medical school. So, and a few dates that will translate to other medical schools as well in terms of the application, the AMCAS application opening in May. And then the first time that you can submit it actually will be in June. So you can be working on it that whole month. But that primary application remains open through December 1st. So you do have a good 6-month chunk to work on it if depending on your schedule and your needs there. Typically, if you do submit your application early in the month of June, you might be starting to see secondary invites in the month of July. And then again, we do a rolling admissions process. So if you submit it in July, you might see an invitation in the next few weeks into August, things like that. But again, if this timeline is kind of based on if you're doing it by these dates here. So the first round of interviews would be in August, September. And then if you did interview those days, you would probably be hearing from us in October in terms of acceptance and or status change. The AMCAS application deadline is December 1st, and then our personal secondary application deadline is December 15th. Once you do all that, we do have 6 interview days, so we're interviewing through this whole time frame. Our first interview day again is August usually, and then our last interview day is February. And then the intent to matriculate deadline, and this is set by the AAMC, that's April 30th, in which they ask all applicants to be holding only one acceptance by that time. And then hopefully if you made it successfully all through that entire process, you'll be matriculating and going through your orientation week in July. So what do you need to apply? So I've broken down here, this is again specific to Virginia Tech Carilion. Your MCAT score. Our minimum right now is a 504. Again, we're reviewing that yearly, and we make changes, and that goes through our admissions committee and voted on and things like that. So this past year was a 504, but stay tuned for more information on that. And then we look at the MCAT score from the last 3 years. So for this upcoming cycle, it would be a qualifying MCAT score would be taken anytime between January 1st, 2020 and October of 2023. And then, of course, a competitive undergraduate GPA, all your prerequisite coursework, which is on the next slide. So I'll let you get a look at that. We're looking for your personal statement. That's going to be in your primary application. Why do you want to be a doctor? What led you to the path of medicine? That's going to be the big question you're answering there. And then again, we're looking for all those experiences that you've listed in your primary application. So anything that you've done in research, anything in the medical field in terms of clinical shadowing, any ways you've been involved with the community, any ways that you've been involved in team-based activities, whether that's sports or clubs, and then also listing any leadership and awards, honors, that types of thing. And then your letters of recommendation, I mentioned earlier that at least one should come from a math or science faculty member. And then a note here that I like to mention is making sure that your letters of recommendation are coming from someone who knows your character, who knows your work ethic, not someone that maybe you took a class with in your freshman year and want to quickly have them write a letter, just because letters of recommendation don't get you into medical school, but they can keep you out. And that just means if there's a red flag that we see in a letter of recommendation, that's something that we kind of then are going back through your application with more of a fine-tooth comb just to see if that holds weight. So again, just make sure that you're kind of vetting your letter writers just as they're going to be vetting you. And then again, your biographic and financial information, that will also all be included in your primary application. Here's a list of our prerequisite courses. So I'll let you have a look at that. And then I see a question in the chat. Are these MCAT dates for the application due at latest by December of this year? So Olivia, if you're asking, so for this upcoming cycle, for this last cycle, we would have cut off new MCAT dates in October. But for the next cycle, it's going to be, we'll be cutting off again in October of next year. So again, I think usually they're only offering MCAT test dates until September, and then the next group of test dates come out in January through February. We're just not accepting those January, February dates for that current cycle. So if that makes sense, feel free to. And then there's another question here. Sorry, I'm reading them as they come in. Bradley asked, if you held two different positions within one organization, would you count those as two separate experiences? That's a good question, because we do see that a lot. That is up to you. I would just say that it's important that you don't double dip your hours. So if you want to write, you could do it two different ways. If you want to say you held like an entry-level position in this organization, and then they voted you to be president of the club as well. So maybe you were the treasurer and then the president. You could write always the organization name. Then in the description, because they'll give you a text box in which you can write about what the experience was. You could put the date ranges beside each title that you had. And that way, and put the total number of hours for your entire time in that organization there. It's just important that you don't say you did 300 hours in this organization and you did 300, and then it looks to be that it's 300 hours of presidential experience, and then 300 hours of your treasurer experience. Just because sometimes our committee members read that as not paying attention, attention to details kind of gone out the window. And sometimes we see applicants put in so many hours that aren't physically possible. So they'll say they've done like 3,000 hours of this club experience, and they did it in this position, and then we'll see another 3,000 hours, meaning they've done 6,000 hours in 1 year's time, and it just doesn't make sense. So that's up to you on how you put it in there. Just be very careful not to say that you were doing, you're not lumping all total hours into both different positions, if that makes sense. So there's no confusion there in the application when somebody reads it. All right, the prereq courses here, so you basically, I'm sure you've had time to read them now, but I will say the recommended, that's not to mean that we're secretly hoping you've done all of these classes on the right as well. It just means that these are great to have under your belt. You'll probably be a little bit ahead of the curve in your first year. You might have a little bit more knowledge than your classmates if you've taken this, but that doesn't mean like, oh, we're specifically looking for people who also have biochemistry classes under their belt as well. So if you're invited to interview, this will look a little different depending on if it's a virtual or in person, but they Both types of interviews include a scenario interview or a set of scenario interviews called multiple mini interviews, MMIs, and one traditional interview. So the scenario interviews were assessing the behavioral competencies set out by the AAMC. Some of them I've listed here. These scenario interviews are done with volunteering members of our community. Like I said, the community is very important to our school, and they love to invest time in the school just as much as our med students like to invest time in the community. So these are volunteers who are going to be interacting with you based on one scenario or one prompt. You'll be graded specifically on your response to that scenario. They have not looked at your, they've not looked at any of your applications, your essays, nothing like that, specifically on your interaction with them that specific day. And then your traditional interview will be with somebody a voting member of the admissions committee who has read your entire application, who knows a lot about you. And that will be more of a chance for you to speak on your character, what brought you to interview at this medical school, what your interests are during med school, after medical school. And so again, and their job is to learn as much about you and then present a lot of that information to the committee after your interview day. So where should you apply then? Like, that's a lot, and there's a lot of medical schools. And as much as I would love for all of you to apply to Virginia Tech Carilion, I know you'll also want to apply to a lot of other schools too, because a lot of schools offer a great curriculum as well. So how do you kind of assess where to apply and where not to? So just like you probably did with undergrad, you will look at a few things. So reputation and competitiveness. So you would look at various schools in terms of their MCAT scores and their GPA ranges, see where you fall, and kind of assess which schools might be the best fit there then. Location. So that could be the size of the city, the community, and also social diversity in the area. So Roanoke is a small city. So we're not a little podunk town, very small and rural based, but we're also not a big NYU type of school where very, very urban and things like that. Size of class as well. So if you're somebody who really thrives in large group lectures and really likes a large student body, then that's something to compare and apply for those schools rather than schools that focus more on small group learning. School record too. So how are the students doing on their step 1 and step 2 step 1 and step 2 exams? So you're looking at the scores there and how they have measured out over the years. And then also, if you're interested in local and or international clerkships in the last 2 years of medical school, see which schools offer those. How easy is it to apply to those types of clerkships? How often do students actually go on them? And then local residency opportunities. So if you're going to somewhere and you end up liking the area, you want to make sure that it's a place you can stay, or at least there's a possibility that you can stay. So hopefully there would be other fellowship or residency opportunities there. And then also, how is the school performing in terms of residency match? Are their students doing really well and matching everywhere, or are we seeing a lot of people opting out and not getting to match? So again, these are things that you should think of and maybe even make a table with to try to figure out where to apply, where to spend your time, who to interview with. And maybe, again, I put this, dream schools versus target versus safety schools. And you can kind of figure that all out using the criteria there that I've mentioned. A great resource is the MSAR, or the Medical School Admissions Requirements website. There is a fee, but I think it's very small to become a member to use this service. But this is a great resource. These are old screenshots. It looks more up to date now. But you can filter through medical schools based on their tuition, based on their class size, based on other graduate level programs that they offer at the same time. even their MCAT ranges to see, well, I'm just going to sort the ones that, that with the MCAT that I have, things like that. So also all of their prereq courses will also be listed there. So that's an all-in-one website that I highly recommend using if you're not familiar with already. So I think that wraps up. I think my next slide is questions. So I'm sure there's a lot of questions, or at least a few. I know we already had some going. So if you guys have any questions, feel free to email me and or raise your hand now, and I'll take some time to answer those questions.
Can you put your email address in? Sorry about that. Please put your email address in the chat for us,
Sure.
please. I think we're over the time. We scheduled the time for 6 p.m. So
Sure.
I anticipate that some of those who have attended will be leaving the meeting shortly, but I want to ensure that students are able to reach out to you if they have any additional questions.
Sure. I have put my personal email in there as well as our general admissions email. We pride ourselves on being very responsive, quickly, and in a friendly manner. So feel free to email myself or our general admissions email, and we're very happy to answer questions as they come in.
Perfect. Well, if there are no questions, I want to thank you so very much for sharing so much great information about your school. And for those who have waited with us all this time, thank you very much. We're going to close out. If you have any lingering questions and you want to ask Hannah directly, you can wait for a minute or two after the session. Thank you all very much. Have a good night. All right, looks like no one. All right, have a good one.
All right, thank you. Bye.
Bye. Bye.